The C word. No one likes to say it. Some people are too scared to say it. But now, with 1 in 2 people expected to develop it, a lot of people end up facing it. When talking about the C word, most people think about a lump, but not all cancers present themselves in this way. Some, like leukaemia, a blood form of cancer, can be difficult to spot, as Lisa McGonigal and Tatiana Graham explains.
Leukemia is a cancer that comes from the bone marrow. The bone marrow is basically the factory of all the blood cells that we have. From this factory come a whole different cascade of other cells, which eventually become things like hemoglobin cells and white cells and platelets. And along the line somewhere, in leukemia, a mutation has developed and the bone marrow then starts to produce leukemic cells. People notice that they're starting to feeling tired or developing lots of infections or noticing that they're more bruised because all these sort of platelets and white blood cells and hemoglobin cells aren't being produced easily anymore because the leukemia cells are producing.
Patients who have leukemia have in the past been told to rest instead of remaining active, and this means that they end up not doing as much at home and not doing the activities that they used to enjoy doing. So we'll end up losing strength, losing cardiovascular fitness, sometimes have their balance affected, and also the different types of treatment that they have can also mean that they have much more muscle weakness and can also affect their balance as well.
One of the first things that their GP will do is take a full blood count which measures all those levels, and what they can see is that everything else has gone down, but they're getting these leukemia blast cells in the circulating blood as well. And then that can be sort of the time where there's a lot of activity and patients are rushed in to start treatment, because with leukemia we need to start treatment really, really quickly because of the way that the disease can sort of quickly develop.
As a physiotherapist, my role involves providing general advice on physical activity and exercise, and also assessing people individually if appropriate and finding out what their individual needs are, what they like doing, what activity levels they used to do, what they think they can continue doing now, or just advising someone on what gym exercise they can do. So it's quite variable.
I was only 20 when I was diagnosed, and I didn't even realise I was ill. But as a young adult or a teenager, you are not alone.
So my role is a youth support coordinator. My job is to support the teenagers throughout the whole journey. This is through creating fun things for them to do, a bit of normality amongst it all, but also it's in a therapeutic way, so helping them when they come across different tests and different procedures, explaining to them what they are and helping them get through it and build their own coping technique. The Teenage Cancer Trust is a charity that was designed specifically for teenagers with cancer to meet their individual needs. It's a charity that supports them in so many different ways. It funds nurses for the units, it builds amazing units that are designed specifically for teenagers. So for example, they might have a pool table, a chill out area, a PlayStation, things that they're going to be into. They also fund things like the youth support coordinator. They support the teenagers through different events that they put on. Like for example, they do a weekend away called Find Your Sense of Tumour, which is when they take all the teenagers away and it's like a conference, so they have talks on different things that will be specific to them. So for example, they'll do a talk on how to get travel insurance, a talk on relationships and how they change, a talk on fertility, a talk on exercise and how to get back into it. So there's loads of different things. It's really, really great. So yeah, so they cover a range of different ways in which to support the teenagers throughout their cancer journey.
Leukemia, a blood type of cancer, which is most common in people aged 65 or over, is more common in men than women, but somehow, someone like me, a 20-year-old female, was diagnosed. Never say never to cancer, but by being young and with the survival rates ever increasing, don't ignore cancer, fight back. Thank you to the Macmillan Cancer Centre, as well as Lisa, Tatiana and Sarah. This documentary was edited and produced by Jessica Sibthorpe.